Hello everyone. Today we will cover a new topic, that is antiplatelet drug. We'll discuss on a new topic, antiplatelet drugs. Okay. So what is of antiplatelet drug? So basically blood having three major components: RBC, WBC and platelet. So platelet basically helps in blood coagulation, forming forming thrombus. After the coagulation process, the thrombus has to be dissolved. If this thrombus does not dissolve, it can lead to several pathophysiological conditions like coronary artery disease, acute coronary syndrome, cerebrovascular disease, cerebrovascular disease, myocardial infarction, stroke, or many other serious medical condition can be happen. So basically, antiplatelet drugs are the class of drug that basically dissolve the thrombus formation. That thrombus formation takes place in the human body. So basically, platelet platelet aggregation is basically takes place in three steps: adhesion, act and aggregation. Okay, discuss one by one in a sequential manner. So basically what happened? Let us assume that this is one of our blood vessels, and here is the damage takes place. Here is vascular damage, and we know that when there is a damage in there is a exposure of endothelium, and this endothelium contains thrombocytic fibrinogen and von Willebrand factor. This thrombocytic fibrinogen and von Willebrand factor basically activate single platelet, and here the receptor involved is glycoprotein 2bixv receptor. After activation, what gonna happen? After activation, there is a release of certain substances. There is certain substances like serotonin, adenosine, thromboxane, epinephrine. So this serotonin and epinephrine basically helps in the restriction process. So adenosine having specific role. So let us discuss adenosine. What adenosine do? Adenosine binds to a specific receptor, that is P2Y12 purinergic receptor. Due to this binding, it decreases cyclic adenosine monophosphate level. Due to decrease in cyclic adenosine monophosphate level, it activates a receptor called GP2B3A receptor. We will discuss about GP2B3A receptor in few minutes. Then thromboxane also having a specific property that it can directly activate the GP2B3A receptor. Okay. Then now the question is, what this G2B3A receptor do? Now we will discuss about GP2B3A receptor. This GP2B3A receptor having a specific type of function. It helps in platelet aggregation. For suppose this is one platelet and this is another platelet. So it helps this receptor expressed on the this two is receptor GP2B3A receptor expressed on the platelet. Happens what happens here, there is certain binding of certain substances that present in the vascular endothelium, that is the von Willebrand factor and thrombocytic fibrinogen. Due to that, there is a aggregation takes place. Platelet aggregation takes place. So when this platelet aggregation carried out for certain time say for we can say for time to days, it leads to formation of thrombus, and this thrombus when it doesn't dissolve, it leads to the medical severe medical condition like coronary artery disease, acute coronary syndrome, cerebrovascular disease, myocardial infarction, and stroke. What we can do is we can block two major type of receptor that present in the platelet. Then we can inhibit this P2Y2 receptor and we can inhibit this GP2B3A receptor. Now we will discuss about the drug. So to remember the drug, there is a mnemonic, that is dad eat pani puri chaat and tea. So you have to remember one statement, that is dad eat pani puri chaat and tea. So we will from this mnemonics we can remember all the drug. D for dipyridamole, A for aspirin, E for eptifibatide, A for abaximab, T for tirofiban, P for pasugrel, C for clopidogrel, T for ticlopridine. Okay, you can remember easily from this statement, that is dad eat pani puri, chaat and tea. D for dipyridamol, A for aspirin, A for eptibatide, avaximab, tirofiban, prasugrel, clopidogrel, ticlopridine. So these are the important class of drug that are used. So let us discuss some important point regarding this class of drug. So if we will discuss about aspirin, the one of the important class of drug, that is, it is a non-steroidal anti-inflammatory class of drug. Nowadays it is frequently used drug in such type of condition. Aspirin basically given in 75 to 150 mg per day. It can inhibits the platelet for 5 to 7 days, because it is a irreversible inhibitor of platelet. Okay, irreversible inhibitor platelet by inhibiting the enzyme COX-1, that is cyclooxygenase 1, and thromboxane synthetase, which helps in the platelet synthesis. Okay, so basically this dose, that is 75 to 100 150 mg per day, it is basically used. This type of this is the mechanism of action of aspirin, and one important action that aspirin show, that aspirin decreases ADP synthesis or ADP release, that helps in the प्लेटलेट adhesion. जो प्लेटलेट का adhesion है वो बेसिकली ADP के वजह से होता है. Okay, then second important class drug is, that is dipyridamol. Dipyridamol, you know that it is a anti-anginal class of drug. Anginal drug which used to vasodilation, we use in vasodilation. Okay, its mechanism is quite different. So what is its mechanism? It blocks, inhibits phosphodiesterase as well as blocks the uptake of adenosine to increase cyclic AMP level. This cyclic AMP potentiate prostaglandin I2, and this prostaglandin I2 helps in inhibiting the platelet aggregation process. Inhibits in platelet aggregation. Okay, so its use is very much important. So what is its use? it is used to enhance it helps in enhance the therapeutic activity of aspirin. एस्पिरिन का थेराप्यूटिक एक्टिविटी ये इंक्रीज करता है. ओके. और इट कैन यूज इन transient ischemic attack. Okay. Or can be used in prophylaxis of myocardial infarction. Prophylaxis of myocardial infarction. Okay. Now we will discuss about P2Y2 inhibitor. Okay. Now we will discuss about P2Y2 inhibitor. Okay. One thing I forgot to mention you that this EAT class of the drug, that is eptibatide, avaximab and tirofiban, these are GP2B3A inhibitor, and this PCT, that is Panipuri Chat T, these are P2Y12 purinergic receptor inhibitor. Okay. Sorry. So now we'll discuss about individual drug. So we'll start with ticlopridine. This is a P2Y12 receptor inhibitor. Okay, and it is a basically in different exam question asked, that is it is a which type of receptor. It is a G protein coupled receptor, that is G protein coupled receptor, act by inhibiting P2Y12 receptor, which helps in decreasing the cyclic adenosine monophosphate level, which helps in activation of GP2B receptor. Okay. So coming to its pharmacokinetic, it is absorbed orally, and it is a prodrug. Ticlopridine is a prodrug and converted into active metabolite in liver. Okay, T-HAP is around 8 hours. T-HAP is around 8 hours. Okay, and its serious side effects are, the question basically ask about serious side effect, that is thrombocytopenia, decreasing the platelet count, increasing the bleeding tendency, some type of jaundice are also seen, sometimes hemolysis also seen. Okay, this side effect is very much important, question can be asked, that is thrombocytopenia, bleeding, jaundice and hemolysis. Okay, if we'll come to clopidogrel, next drug is clopidogrel, and you know that clopidogrel is a prodrug, and question asked which of the following drug is a prodrug, so ऐसे करके क्वेश्चन पूछ सकता है. तो क्लोपिडोग्रिल जो है ये बहुत ही इंपॉर्टेंट ड्रग है. ये है irreversible inhibitor of P2Y12 receptor. Okay, it is activated as it is a product. It needs to be activated in the body so that to produce its therapeutic action. Its activation is depend upon CYP2C19. Remember this this microsomal enzyme CYP2C9. So what CYP2C9 do is to CYP2C19 is basically activate the clopidogrel. But you and one important class of drug, that is proton pump inhibitor, like omeprazole. What omeprazole do is omeprazole inhibit omeprazole inhibits CYP2C9. So what is the net interaction? The therapeutic action decreases. किसका डिक्रीज करेगा? क्लोपिडोग्रिल का. बिकॉज देखो मैं आपको फिर से समझाता हूँ. लाइक जो क्लोपिडोग्रिल है ये बेसिकली अ प्रोड्रग है. So and we know that prodrug are kind of drug which are metabolically inactive. To show its therapeutic activity, it has to convert it to its active metabolite inside the body to show their therapeutic activity. So CYP2C9 is the one of the important enzyme that helps in the activation of clopidogrel. When you will take clopidogrel with omeprazole, that can causes inhibition of clopidogrel activation that leads to decrease the therapeutic action, and that also leads to the antiplatelet action also reduces. Okay, so where we can use this clopidogrel, same as I discussed, it can be used in different kind of cerebrovascular disorder, or we can use it in acute coronary syndrome, we can use in myocardial infarction, we can use it in stroke. Okay, so and coming to the side effect also similar to the ticlopridine, like bleeding is the one of the important side effect, bleeding and thrombocytopenia. Okay, then we'll discuss about GP2B3A class inhibitor. So one of the important drug is abaximab. As its MAB indicate, it is a monoclonal antibody and it is a chimeric type of monoclonal antibody. Chimeric type of monoclonal antibody against GP2B3A receptor. Okay, it is non-antigenic, but it can cause hemorrhage. Okay, so the major side effect associated with this is thrombocytopenia. One of the complication is hemorrhage, another complication is thrombocytopenia. So it's one of the important use is PCI, that is precutaneous coronary intervention. what it is, precutaneous coronary intervention. If we'll roughly made a diagram, for suppose this is our coronary artery and there is a formation of thrombus. Okay, there is a formation of a thrombus. So to dissolve this thrombus, what we can do is we designed a type of a medical instrument whose structure is like this, and it is a rough diagram, and this basically rotate in a circular motion. And what we have to do is we have to insert it in the coronary artery and it dissolve the thrombus. Okay, this technique is called as precutaneous coronary intervention. This is all about abaximab. So another important drug is eptibatide. It is a cyclic peptide. Cyclic peptide selectively inhibits GP2B three a receptor. Okay, and it's inhibit the platelet aggregation. Here, here is the main side effect is bleeding. Bleeding. So coming to its uses, so where we can use this antiplatelet class of drug. So there are several uses where we can use this antiplatelet drug. There are several medical conditions like coronary artery disease, coronary artery disease, acute coronary syndrome, then this acute coronary syndrome may be of three types: unstable angina, ST elevated myocardial infarction, non-ST elevated myocardial infarction. These are a different type of condition that is associated with our coronary artery. In ST elevated myocardial infarction, there is a elevation of ST segment, there is a necrosis of the myocardium, there is a appearance of the biomarkers in the blood. Same same thing that same thing will be seen in case of non non-ST elevated myocardial infarction, but there is a the ST segment has not the ST segment of the ECG will not be elevated. In unstable angina, there is a no necrosis there, but there is a symptoms of acute coronary syndrome will be there. Okay, then next disease condition is cerebrovascular disease. Then venous thromboembolism, peripheral vascular disease. So in case of peripheral vascular disease, we basically give an aspirin or clopidogrel. We basically give. Okay. So that's all about antiplatelet drug. Thank you. We'll wait with a next important topic. In next session, I will give you a brief overview on anticoagulant. So till then, thank you. Have a great day.